Welcome to Clinical Minute. Desiree is a 24-year-old woman, gravida 1, para 0. She just had a positive home pregnancy test, is 10 weeks LMP, and is presenting for her first OB visit. She reports taking oral contraceptive pills up until the time of her positive pregnancy test, but admits she may have missed 1 or 2 a month for the last several months. Her long-term boyfriend joins her for the visit. Prior to today's visit, the couple discussed their options, including having an abortion, but have decided to continue the pregnancy since they have talked about having kids soon anyway. A review of her full health history confirms that it is completely normal. She is generally healthy and has no current complaints. You confirm her pregnancy with a serum beta HCG and complete a physical exam and ultrasound exam with normal findings. You mention that you see she was on the pill when she found out she was pregnant. You comfort her by acknowledging that nearly half of all pregnancies in the U.S. are unintended. During the visit, you tell Desiree that a lot of patients like to party, and so you have a few questions you ask of all your patients. Ensuring a non-judgmental tone, you ask, "How often do you party?" She replies, "A few times a week." You probe further while remaining non-judgmental. When you say a few, how many would you say that is? 3, 4, 5, more? She says, "Probably 5, but I only party really hard on the weekends." You go on to ask her about how much she drinks, both during the week and then when she parties really hard on weekends, holding up a 16-ounce disposable red plastic cup to estimate the number of drinks she has each time she parties. She shares that during the week, she tries to keep it to 3 cups of beer in a night, but on the weekends, she often drinks 5 to 7 drinks in a couple hours. You know that prenatal exposure to alcohol can cause permanent neurologic and behavioral problems. The umbrella term to describe this constellation of issues is fetal alcohol spectrum disorders, or FASDs. One of the disorders that falls under the FASD's umbrella is fetal alcohol syndrome, or FAS. Individuals with full FAS present with a unique cluster of facial anomalies, growth deficiency, and structural and/or severe functional impairment to the central nervous system. In addition to full FAS, FASDs can include a wide spectrum of adverse effects from prenatal alcohol exposure. You clearly remember having seen a picture of children with full FAS facial features. Based on what Desiree has told you, you know Desiree is currently drinking, and you recognize that she binge drinks on the weekends. You know that the National Institute on Alcohol Abuse and Alcoholism defines binge drinking as a pattern of drinking that brings a person's blood alcohol concentration to 0.08% or above. This typically happens when men consume 5 or more drinks and when women consume 4 or more drinks in about 2 hours. Binge drinking is most common among young adults ages 18 through 34. Understanding the potential impacts of prenatal alcohol exposure is tricky because the risk is not based simply on the type or amount of alcohol consumed, and research has not found a safe level of exposure. Studies with twins have shown that non-identical twins exposed to the same level of alcohol can have markedly different outcomes. In fact, it is common for one twin to be born with full FAS and the other to show no adverse effects. As you consider the Surgeon General's advisory, which states that there is no known safe amount to drink during pregnancy, including the first few weeks of a pregnancy, you decide that it is imperative to address alcohol use with Desiree. What is your next step for educating and counseling Desiree about alcohol use during pregnancy? You consider using a more formal, validated screening tool such as the TACE, TWEAK, or AUDIT. In the past, you have successfully used the TACE to screen patients' alcohol use, which is based on the CAGE and was specifically designed with prenatal use in mind. The TACE consists of 4 questions. How many drinks does it take to make you feel high? Have people annoyed you by criticizing your drinking? Have you ever felt you ought to cut down on your drinking? Have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover? An affirmative answer to the first question, T, is worth 2 points, and all other questions are worth 1 point. A score of 2 or more is considered positive for problem drinking. In Desiree's case, it's clear that you need to move forward with supporting her in reducing and hopefully stopping her drinking. Rather than using a screener, you tell her that it's your job as her prenatal care provider to help her have the healthiest pregnancy possible, and that it's important for her to know that exposure to alcohol can cause problems in a developing fetus. You educate Desiree about the risks of consuming alcohol during pregnancy, focusing on these key messages. There is no known safe amount of alcohol to drink during pregnancy. There is no safe time to drink during pregnancy. Alcohol can cause problems for a developing fetus throughout a pregnancy, including the time before a woman realizes she is pregnant. All types of alcohol are equally harmful, including hard liquor, wine, and beer. It is never too late to stop drinking and reduce the risk of FASDs. Because brain growth takes place throughout pregnancy, the sooner a woman stops drinking, the lower the risk will be to the fetus. You go on to ask her how she would feel about cutting out drinking for the rest of her pregnancy. She tells you she doesn't think she can do that. She also responds that many of her friends drank when they were pregnant, and their kids are just fine. You tell her about the twin studies, and emphasize that there is no way to know how her drinking will affect her baby. Using the FASD's screening and education algorithm, you determine that Desiree is unable to stop simply based on the educational information you provided. Although you had one training on screening and brief motivational interviewing, which is where you learned about the TACE, you feel like she could benefit from support from someone with more extensive training in this area. You tell Desiree you are concerned about her and her developing fetus, and that you'd like to refer her to an organization that specializes in helping people cut down on or stop drinking. She says she'd be willing to at least talk to someone. Using the National Resource Directories, you are able to find an outpatient alcohol treatment provider who works with pregnant women. You provide her with contact information and have her fill out a release of information form, allowing you to discuss her progress with the alcohol treatment provider. You call the provider to inform them of your referral. Before moving on to your next patient, you record information about Desiree's alcohol use and your referral in her electronic health record. In 3 days, you call Desiree at home to see how things are going with scheduling an appointment with the treatment provider. She says she forgot, but will call now. A week later, she begins treatment and signs a release of information form, allowing you to get regular updates between prenatal visits. You continue to ask about Desiree's alcohol use and treatment at each prenatal visit, and record information in her electronic health record. You also encourage her to bring her boyfriend with her to her prenatal visits whenever possible, since you know how important partner support is in reducing alcohol consumption. You continue to support and commend her on all reductions in drinking. When her boyfriend joins her, you emphasize the importance of his support in helping her cut back on her drinking, and maybe even cutting back as a show of support. By the end of the pregnancy, Desiree has dramatically reduced her alcohol use.